Hello everybody, my name is Bree and welcome back to Bree's Science Lab. Today we'll be going over an introduction to human anatomy. Often schools will split up human anatomy into either Anatomy and Physiology 1 or Anatomy just by itself. We will be going over just human anatomy, an introduction to it. So we're going to focus on terminology and a few important points that you should know before really diving into your classes. By far the most important thing to know before you start your human anatomy course is what's known as anatomical position. Anatomical position refers to the position of the body when it is in this position. So this right here is anatomical position. If you notice, I am facing forward, my hands are out by my sides, my thumbs are more lateral, and my pinkies are closer to my body, right? My feet are pointed forwards and slightly out. So, while in this position, this is how you will usually refer to things in your human anatomy class while they're in anatomical position. So now that we've gone over that, we can go over some of the other terms. Some of the first terms you're going to come to in your class are going to be anterior and posterior. Anterior refers to the front portion of the body. Posterior would refer to the back portion of the body, so my back. You can also use anterior and posterior to reference structures in the body and tell you geographically where they are in the body in comparison to another structure. So for example, I could say that my sternum, which is right here, is more anterior than my heart. Right? Because my sternum is right here, but my heart is inside. So my heart would be closer to my posterior rather than my sternum. So that's an example of anterior and posterior. Now, you can often see shorthand notation of anterior and posterior, and they will be sometimes written like anterior, period. If you guys can see that, let's try a different color. Anterior can be shortened to A and T, period, and posterior will sometimes be written like this. Posterior, okay? Now, P-O-S-T, period. The next thing we're going to come to is ventral and dorsal. Ventral is kind of like anterior. Ventral refers to the ventral part of the body, so more like belly side, while dorsal refers to the back side, okay? I like to think of it as like a dolphin. A dolphin has a dorsal fin, and that's going to be on their back, right? Another similar term would be cranial and caudal. So this refers mostly to when, humans hadn't fully evolved, and more so like we had tails and stuff, and closer to that. So it's not used as often, but you might hear it. Caudal means closer to the tailbone, while cranial means closer to the skull. Those three kind of are similar, so just be careful with those. Our next one is going to be superior versus inferior. Superior means above, while inferior means below. So if it helps to remember it, I like to think of this as management, right? So if you're at work, your superiors are above you, right? And your inferiors are below you. So the superior would be like the manager. The inferior would just be your co-workers, So that would be superior and inferior. For an example, you could say that my head is superior to my hips, okay? My head is above my hips. You could also say that your knees are superior to your feet, right? Or you can say your feet are inferior to your knees, right? Because my feet are below my knees. Next on the list, we are going to have proximal and distal, okay? So this one we want to make sure we're in anatomical position. Proximal and distal. This is referred to as the midline of your body while you're in anatomical position, all right? And this would be more like your midpoint right here near your belly button. Proximal means it is closer to the midline of your body, while distal means it's further away. So these are comparative terms. So you can't just say, oh, my elbow is distal. Distal to what, right? You'd have to say my elbow is distal to my shoulder, which means here's my shoulder, here's my elbow. My elbow is further away from my midline than my shoulder is, okay? In anatomical position, that is. You can also say my knees are more proximal than my feet. You can say that, let's see, your knees are proximal to your toes. You can say that your ankles are distal to your hips, okay? So those are comparative terms. So you have to use that in a comparative sentence in reference to another structure. That being said, now we're gonna go over medial and lateral. So this is a fun one. You're gonna wanna make sure you're in anatomical position again, or your patient or your model, right? Medial would be, we'll do it like using my face. So medial would mean your eyes, right? So your eyes are closer to that midline. So medial means closer to that midline on the inside. Lateral refers to the outside. So my ears are lateral. My ears are on the outsides of my body. That being said, median is also a term you might hear. Median means directly on the midline. So if we're in anatomical position and we cut ourselves like this, down left and right, this line right here would be median. So my nose would be median. My sternum would be median. My belly button would be median. My eyes, medial with an L. My ears, lateral. My shoulders, lateral. My thumbs, lateral. My pinkies, medial, right? So that leads us to superficial and deep. Superficial and deep. So when you get into anatomy and several other classes, you're gonna get membranes, you're gonna get layers of muscles, you're gonna get, skin. So skin has, multiple layers. And you want to know which one is closer to the surface and which one is deeper, more inside your body. And that's where superficial and deep come in. So superficial means closer to the surface, right? Deep would mean more inside. So my skin is superficial to my muscles, right? My lungs are deep to my ribs, right? It can be used like that. Typically, you're going to see this used with muscle layers or skin layers. That leads us to ipsilateral and contralateral. So we are in anatomical position, right? Ipsilateral refers to the same side. Contralateral refers to opposite sides, right? So say you have a patient come into the ER and they hurt both their right shoulder and their right hip in a fall, okay? They fell down and they hurt their right hip and right shoulder. That would be known as ipsilateral because they're both on the right side, right? But say it was some crazy accident and your patient hurt their right shoulder and their left hip. That would be known as contralateral injuries, okay? Because it's your right and your left. That's opposite sides on your anatomical position, right? So next, that gives me a good stopping point to explain left and rights. So I know that when you're thinking, oh, this is my right, so my patient's, that is going to be their right? Like if we're standing across from one another, you're going to think it goes the same, but that is not the case. It is always going to be your patient's left and right, not yourself. So say I am facing my patient right now, right? My right is going to be their left. So if I say the left shoulder, it's going to be on this side, right? So closer to the camera. Their right shoulder is going to be closer to the wall, right? Because it's the opposite of me. That's just something to keep in mind. It'll often trip people up in class when they're learning structures, because you will have to say if something's right or left. Now, those are kind of all of the directional terms. Now we come to what I would like to say more structural terms, all right? That means our first one I have here to learn is a sulcus and a fissure. So a sulcus and a fissure. A sulcus is a groove, okay? So you'll see this when you get to the brain, in the skull, which is usually the first thing that's taught in your class. A sulcus is a groove. So it's just like a slight indentation, like a line. A fissure is a deep groove. So that's gonna be super, super deep. So say like, when you get to the brain, you'll see the difference between a sulcus and a fissure, but a fissure is just basically a really deep groove. So it's gonna be like this. Say this is a fissure, right? But this is a sulcus, right? This is a fissure, right? So there's a difference. See, this is a lot thinner of a groove, not as deep, but a fissure, that's a lot deeper. Now, you're also gonna have what's called a foramen. A foramen is a hole that's going through a structure, right? So you'll see foramen in the skull, like foramen magnum, foramen spinosum, all of those. Those are holes going through structure. Typically you'll see them in bone, but what you want to ask yourself when you see a foramen is, why is that there? You know, so this will really help you when you get into class and testing. You want to know what goes through a foramen, right? Because you don't just have random holes throughout your body. You're going to have a reason for those holes. So you're either going to have a vessel go through it, you're going to have a muscle go through it, a nerve. There's usually something going through that foramen, and that's why it's there. And you'll be asked about these contents of the foramen, and you'll want to know them when it comes time for testing. Next, I have a fossa. So a fossa is a smooth, depressed surface. So think of my hand right here. It's pretty smooth, but it's depressed. See, if I poured some water in here, it would hold water. So this is known as a fossa, a smooth, depressed surface. This will typically be found in on bones. So your scapula, your shoulder blade back here, that has a fossa, and it's just a smooth, depressed surface. It can hold water, basically, is how I would put it. So it's not like this, it's not rounded on top, it's rounded inside, it's indented. Now it comes to a meatus. So if you heard your external auditory meatus, that's a hole in your skull where your ear nerves run through and everything like that. A meatus is also an opening, typically through a bone. But a meatus is not just a hole, it's more like a tunnel, okay? So it's like a longer opening. So say that this is your foramen, right? It's going through, it's pretty thin, right? It's that thick. But a tunnel, okay, a meatus is gonna be like this. It's still an opening, it's just a long opening. Think of like a pipe or a canal. That brings us to process. A process is usually also going to be with bone, and a process is like a piece that's jutting off of a bone. So if you think about your vertebrae, you're going to have the spine of your vertebrae. You're going to have these things called processes, and that's why you can feel like your spine, if you feel it, you can feel it kind of like pointy pieces going all the way up and down your spine. Those are actually processes, plural, or process singular, and they're just a piece that's jutting off of your bone. Now, that brings us to condyle and epicondyle. So condyle is also going to be for your bone, epicondyle as well. Condyle is going to be a piece of a bone that articulates with another bone or another piece. Articulate just means that they touch, right? Or they come together. That's what articulate means. It's a fancy word for touch. Now, that's what a condyle is. A condyle is pretty smooth usually. It might be rounded because they'll make up joints. Now, you don't want a joint to be super, super rough and like bumpy and stuff, because then it won't move right? You want like a smooth hinge. So those structures are going to be pretty smooth usually. Now, epicondyle. The word epi means on, around, or upon, right? So immediately on, upon, around. So epicondyle will be the piece that's immediately surrounding the condyle, and they will typically look pretty similar, right? That brings us to a facet, okay? Or fasces for plural. A facet is the other part that's articulating, right? Now, a facet is going to articulate with a condyle usually, and it's just the other part that's touching. Let's see. Articulation, I already went over. A crest. Okay. Again, you'll see this on your hip bones, your scapula. A crest is an edge that's usually thin, pretty crisp, and that's a crest, right? And sometimes it'll be rounded like a crescent moon almost, but not always. A line. So a line is just a line. Sometimes you'll see a line going through on a bone. It's just, sometimes it'll be referred to as a line, like something line. It'll have a name. Now, we have tubercle, tuberosity, and trochanter. These three words, tubercle, tuberosity, and trochanter, refer to basically a raised portion of bone, and in that order they are increasing in size. So, a tubercle is a very small raised portion of bone. It's going to look like a little bump, right? Just a tiny little bump. Now, tuberosity, okay, is going to be slightly bigger, right? You'll see this on your hip bone. It's decent sized, right? A trochanter is a lot bigger, right? It's a lot bigger portion, and you're going to see this on your femurs, and it's just a lot bigger. Now, this is not always the case. As you'll come to know in anatomy, there are a lot of exceptions. You never have an always rule, okay? There is always going to be an exception to a rule. We don't like to say that anything is hard and fast, you know, exclusively this or not exclusively that. There's exceptions, but these are going to be general rules. That leads me to the planes of the body. So this is a different section of terminology. The planes of the bodies are also going to be known as cuts of the body. So say you are looking at a cadaver, which if you don't know, a cadaver is a dead body that is used for science or for anatomy studies, anything like that. A cadaver will be cut, or a model will be cut in a certain way to let you view muscles and structures from that view. So to start off with, we're gonna have a frontal or coronal plane or a frontal or coronal cut, right? So what that means is you are looking at the model or the body from a front or back half. So a coronal cut or frontal cut would be cutting your body into a anterior and a posterior portion, right? So basically a front and a back half. So looking at it from the side, it's gonna come right here and it's gonna cut down like this, right? So a coronal cut will allow you to see inside the body, and let's say you can see just my back ribs, and you'll be able to see like the back portion of my ribs and the muscles of my back from the inside, if that makes sense. Next, we have a mid-sagittal cut. A mid-sagittal cut. So the sagittal plane separates the left and right sides of your body. So it's going like this. Mid-sagittal refers to right down the midline. Okay, so that means you're gonna have an equal left and right half. Now, parasagittal means it's a cut that's separating into left and right pieces. However, it's not right down the midline. So you can cut like right here, and technically that would still be a left and right cut, correct? So you can see inside my body going this way, basically, if it was a parasagittal cut. So it just means same cut, just not right down the middle. Right down the middle would be known as mid-sagittal. That leads me to transverse, or sometimes known as horizontal planes or cuts, right? That would be going right here and cutting me in half. So right here, make a cut, that's gonna be that transverse or horizontal cut. That allows you to see down and up, right? So that's gonna separate me into top and bottom halves. That leads us to the last one, which is gonna be oblique. Same thing, you're gonna have a top and a bottom half. However, or pieces, I better say. However, that cut is gonna be made diagonally, not horizontally. So, those are the cuts and planes of the body, and often you will be asked, they'll show you, your teacher or your TAs, whoever, are gonna show you. They're gonna show you a picture, and they're gonna ask you, you know, what is this structure? And you'll answer, you'll say, that is the heart, okay? And then they're gonna ask you, great, what cut is it, right? How did we cut this? And you're gonna wanna know, they cut it, transversely, they cut it sagittally, and you're gonna go over some movement terminology now. You won't get to this for a while in your class, most likely. This will be in regards to your arm modules and your leg modules, not so much your organs or your face or your skull or anything, because those don't typically move. Now, to start off, we are going to go over flexion versus extension, right? Flexion, if you go to the gym, when you flex, all right, you go like this, right? You're going like this, you're going like this, Either way, however you flex, you are decreasing this joint angle right here, right? So in anatomical position, our arms are straight, but if I decrease that angle right here, that would be known as flexing. So that motion where it's decreasing that angle would be known as flexion. So you're doing bicep curls in the gym, right? You're going like this. Those are examples of flexion. You are decreasing this angle right here. Extension is the opposite of that. So say you're in the flexion motion and you go out, that is known as extension. That is increasing the angle right here. So you're going from inward, which is a decreased angle, let's say, what is that, like 30, all right, to 180. That's an extension because it's increasing that angle. It's getting bigger. Extension, if you go to the gym, a good example of that would be tricep extensions, right? So that's going from like here, where you're going like that, okay? So you're going up. Those are terrible exercises if you've ever done those, okay? But I might just be saying that because my triceps are a little weak. But that's an example of extension, right? You're increasing that angle. That being said, you also can have your hips involved. So it's not just your arms, right? If I do this, I am flexing that hip, okay? Because I'm decreasing. So right now, hip 180, right? 180 degrees. If I decrease that angle, it's getting smaller. This is a 90 degree, right? Now, if I let it drop, that's extension because it's going from that 90 to that 180 again. But if I bring my knee up, that's hip flexion because I'm going from that 180 to 90, I'm decreasing that angle. Now, that being said, we also have that for our leg, right? So not just hips, but we can also have knee flexion, knee extension, flexion, extension, right? Increasing that angle, decreasing that angle. So kicking a soccer ball, extension. Butt kicks, if you did that in PE when you were in school, examples of flexion. That being said, some hip examples. So going upstairs, so right, I'm going upstairs. That's hip extension because I have to bring that hip back. I'm increasing that angle. Sprinting, another one. So you're going like that, right? You're sprinting, that leg's going back. That's hip extension. You're increasing that angle. You also have dorsiflexion and plantar flexion. That's in regards to your foot. And plantar flexion refers to kind of pointing your toes down like a ballerina. Dorsiflexion would be bringing your toes towards your shins. Now, that can also be referred to as ankle flexion and ankle extension, but those aren't typically used. We normally use dorsiflexion and plantar flexion, even though it's kind of silly because they're both saying flexion. It's just referring to plantar, which is the bottom of your foot, and dorsi, which is the top, and it's referring to which way your toes are kind of going. Now, we can also go over abduction and adduction, right? Abduction, abduction, and adduction, adduction sound very similar, but they are not the same. So let me go ahead and write this down for you guys. So we have abduction and we have adduction. Apologies for my handwriting. I think you guys can see that though. So, abduction and adduction. These are tricky ones, but I'm going to give you a story and it's super easy to learn them once you hear this story. So, abduction, you are abducting. You are taking something away, right? So, let's say you are abducting your leg. Your leg's going to go outwards. You're taking that leg away. So I like to reference the midline, right? Because we always like to reference the midline in anatomy. So if you're abducting from your midline, right, AB, you are taking away from that midline, which means you're making that midline thinner. So instead of like this, AB ducting, you're taking it away. Now my midline's thin. You only have one leg here, right? But a deduction, adduction, right? You're going from out and you're adding to that midline, right? You're adding to that midline. Now my midline's super thick because I brought that leg back. I added it to my midline, so it's a lot thicker now, right? Now, same thing can be said with your arms. So abduction, taking my arm away. I'm abducting it, right? I'm taking it. But adducting, adducting, I am adding it back to my body, right? Adduction. So abduction versus adduction, that's a quick way to remember it. Flexion versus extension, those are also comparative terms. So flexion, decreasing angle, extension, increasing angle. And now we can go ahead and get started on some whiteboard questions.
You guys, so I have written a few things on the whiteboard here as a quick quiz for the end, and we'll have a few more questions, but this is a format that is similar to what you will see in your classes. So the first one up here is the knee is more blank than the ankle. Now go ahead and pause the video if you need time to answer this. I'll give you guys a few seconds. All right, the knee is more, you can say either superior or you can say more proximal, sorry, almost tricked myself. The knee is more proximal than the ankle, or if you said the knee is more superior than the ankle, both of those would be correct answers. Now, in the second one right here, we have an anatomical position. The palms are, if you said anterior, that would be correct. If you said facing forward, that would also be correct. Now the last one down here, a little diagonal, but that's okay. The patient has an ipsilateral injury. They have injured their blank ankle and their blank hand. All right, I'm gonna give you guys a second. If you answered the left ankle in the left hand, you would be correct. If you answered the right ankle and the right hand, you would be correct. However, if you answered the left ankle in the right hand or the right ankle in the left hand, you would be incorrect. Ipsilateral means the same side. Contralateral means differing sides.
For quiz, now we're going to do some more verbal questions, right? To make sure you guys have a good handle on this. So, right now, I am in what position? I'll give you guys a second. If you said anatomical position, you would be correct. Anatomical position refers to the hands out by our sides, palms more lateral, thumbs more lateral, palms facing forward, pinkies inside, feet forward but slightly out, and about shoulder width apart, and I'm facing forward. That is anatomical position. Now, let's see, another question. While in anatomical position, are my pinkies more medial, more lateral, or median? If you said that they are more medial, you would be correct. Medial with an AL at the end. Medial means closer to that midline, but not on the midline, right? My nose is medial, lateral, or median. If you said median with an AN at the end, that would be correct. Your nose is median, your eyes would be medial, your ears would be lateral. So, if you got that, good job. Let me think. All right. My shoulders are blank to my hips. If you said superior to my hips, you are correct. My shoulders are superior to my hips because superior means above. Let's see. My glutes are blank, are more blank than my sternum. What would your answer be? All right, if you said one of these three, you would be correct. Caudal, dorsal, or posterior, any of those would be correct, right? Caudal means closer to the tailbone. My glutes refers to my gluteus maximus and minimus and medius. All of those would be closer there. Now, posterior just means your back in general, and dorsal also means your back. It's just a different word for that. Another question we could do is, let's see, if I have injured this hand and this knee, okay, if I injured those two parts, is that an ipsilateral or contralateral injury? If you said contralateral injury, you would be correct. Those are on opposite sides, however, of the midline. However, if I injured this hand and this knee, what kind of injury would that be? Good. That would be an ipsilateral injury. It is on the same side of that midline, right? Midline going down in anatomical position. Now, this is going to be a tricky one, all right? If I am your patient or I am your model, what would this be right here? This is a hand, we know that, but is this the right or left hand? If you said right hand, you would be correct. Remember, it's always going to be opposite of yourself because you are looking at a model. That is, if they're in anatomical position facing you, right? However, if I turned around, right, and I showed you this hand, then it would be your right hand, or their right hand, because I'm facing away from you. So then you can use yourself as, you know, an example. But if they're facing you, that means it's going to be opposite of yourself. So left hand, right knee, right ear, right eye, left eye, right nostril, left nostril. But right leg, left leg, right? Okay? Right hand, left hand. Just to give you guys an example. Now, thank you for joining me. I hope this helped. This is going to be a good video to watch first if you're new to my channel. And if you have any questions, please drop them in the comments below, or you can ask them on my website, breezesciencelab.com, which will be up and running. Thank you.